listen to me rant on again. There's really not a lot I can do with this particular topic. So I'm going to reduce the reading. I'm just going to talk and write things down, and you can choose what you want to write. The textbook and the online can certainly be used as well. So what we're going to look at is how do we collect data? And this is basically going to cover 2 sections of homework. There are 3 main ways to do it. The 2 major ways are observational studies and randomized experiments. When you look at where statistical analysis comes from, where they go and collect data and find things out, they almost always collect it using what is called observational studies or randomized experiments. The third one is a minor one. It's called a case study. And case studies are a little bit different. What you do in a case study, so let's get that one out of the way first, is that you look at one person or a very small group of people and you look very detailed information about them. So I got a kind of online description, which I kind of like, so I'm just going to read it out loud. A case study is an in-depth study of one person or a group. In a case study, nearly every aspect of that subject's life and history is analysed, and then you look for patterns and causes of behaviour or health. I'll give an example of what a case study might look like. You get 100 people who have got breast cancer, right? So you collect randomly or whatever way, and you make them your case study. And you look at them and you look at everything that you possibly can. You look at what jobs they did. You looked at their lifestyle. Did they do exercise? Did they smoke? Did they not smoke? Did they take particular medication or not? And you take lots of information about it. And what you're kind of doing is you're casting a huge big net to see if there's anything that is kind of common to a lot of them. Doesn't need to be all of them, but a lot of them. Because that thing, whatever it might be one of the triggering mechanisms to getting breast cancer. Right. Now, I can tell you a couple I know already, which definitely came from case studies. Do you know one of the main causes of breast cancer is genetic? In other words, if your mother had it, right, or a sister had it, or an aunt had it, you're 2 or 3 times more likely to have it, to get breast cancer. There are other causes of breast cancer. Smoking. You might think, what the heck is that? Well, do you know when you catch cancer and it goes to your lungs, doesn't it also sometimes go to other parts of your body? And one of the parts of the body it goes to in females very often is it goes to their breast, so they get breast cancer. So can you see you can look things like that? Case study, for instance, was once used to find out what was causing Legionnaire's disease. Don't know if you know that particular disease. It's called Legionnaire's disease because it is a very dangerous version of pneumonia, right? It affected your breathing in your chest and a lot of people died. And it happened in an area where a lot of people caught it. And it wasn't happening nationwide, it was just in an isolated area, and they were scratching their heads and they were thinking, what the heck's going on? So everybody who got Legionnaire's disease became the case study, and they looked at, what did they eat? Did they go to a swimming pool? Did they do this? Did they do that? And what they finally figured out was that all of them, or a large proportion of them, went to a conference or were near a building that conference was in. And in the roof of that building, they had an air conditioning system that had water in it, and that water wasn't sanitized. And in that air conditioning system, the Legionnaire disease bacteria kind of lived. And then it get passed through the air conditioning system. And so the people who were in the building got it. And that's how they figured out what that is. Do you know when they have food outbreaks, people, I'm trying to think of that. Do you know when you get sick when you eat bad food, right?
Salmonella or something.
Salmonella, right. There's a salmonella outbreak there, right? Let's suppose Bremerton suddenly gets a large proportion of serious salmonella. The first thing they're going to do is put them into a case study and say, okay, guys, figure out what's the common thing. Did they all eat at McDonald's? Or at least got a takeout from McDonald's? Okay, let's home in McDonald's. It must be coming from maybe bad meat. Or was it the lettuce that you used in Taco Bell? You're right, because once you get there, you then have to figure out which piece of the food was causing it. And then you've got kind of, okay, with, they then put out, those things where they say all lettuce between this date and that date, remove them from the stocks of the shelves, right? They've found the source. But you see this as a case study. That's a kind of way of getting information. So that's one. And very specialized, used in certain cases. One last story. Thalidomide. You remember thalidomide? Does anybody know about that? It's a long time ago now. The nursing people might know about this. What was happening? Yeah?
It was a drug that like people were taking, and it was causing birth defects.
Yes.
That were pregnant.
So what happened was that they noted birth defects. Most of the birth defects happened to be shortened or missing limbs, right? And so they were noticing that babies were getting born at a higher proportion, because it's always happens, right? It's a rare event, but it does happen. But it was happening a lot more than the usual rareness. And so they collected data. They did a case study on that, and they tried to find out what was the common causality. And they found out in not all the cases, because some parents just had babies with that kind of issue just because, genetics and life get in the way. But they found out what it was a drug that they were taking, which was just for morning sickness. Pregnant mothers took it to try and, not feel sick. And that was the cause. And that's how they found it. Collect a group of people that you want to figure out what the heck is causing the problem, and just ask everything. Find out what milk they drank, right? Find out if they were taking a special pill. Did they all work as radiologists in a hospital, right? I don't know what it is, but you find something that's common, and that might be the reason why it's happening. Okay, let's look at observational studies. The main thing that makes it an observational study is that you don't choose who does what. So what do I mean by that fake sense? Right. Observational study. One example of it could be, you want to find out if boys are more aggressive, little boys are more aggressive than little girls. So a doctor watches them or takes a movie of them, so he doesn't even need to be there. And he has a little clipboard and he checks the number of interactions that are going on and which ones would be considered violent, like pulling the toy off the other kid, right? Or one kid hitting another kid, or one kid throwing something, right? So you had certain things that you would call violent behavior, right? We're talking little toddlers there. And he would register whether it was a boy or a girl who was doing it and how often that happened. And then you would collect data and you would say things like, boys are 30% more violent than girls, or whatever it might be, right? Now, you didn't choose, you didn't get two groups and say, this group be violent and this group not. You just watched what happened, right? And you let it unfold. Observational studies are sometimes the only way you can get data, because morally, you're not allowed to do certain things to people. So here's a big story. Do you know why it took so long for smoking to be linked to lung cancer? I know there was financial reasons for it, but why it was so difficult to get proof that smoking actually was a major contributor to lung cancer was because all the data was observation. And it was very strong data, right? Lots of people who smoked got cancer, right? And lots of people who didn't smoke, right, didn't get cancer. And that would normally be good evidence, except they could use the old lurking stroke confounding variable problem. People who smoke a lot also do very often other bad things. They don't exercise a lot. They probably are overweight and eat too much. They probably are stressed more than most. That's why they smoke, right? Can you imagine there's lots of other things that people who smoke also do? And then the argument came, well, why is it smoking? Maybe you get lung cancer because of stress. Maybe you get lung cancer because you don't exercise. Maybe you get lung cancer because you do one of the other 12 things that people who smoke a lot do. You see, it's very difficult to separate out which one of the possible causes is the real cause. And that is an issue. Observational studies find it very difficult to get concrete proof that one thing causes another. If I wanted to do a really good study on smoking cancer and cancer, you'd have to be in Nazi Germany. And what you would do is a randomized experiment. You get 200, let's say 200 random people, right? Old, young, joggers, couch potato people, the whole lot, and split them into two groups. And you say to the first group, you're smoking 200 cigarettes a day. Don't care if you want to or not, I'm making you, right? You're choosing what they have to do. And you say to the other 100, you're never allowed to smoke one cigarette. We'll shoot you if you do, right? Because you need a fascist country to get away with this. And then you just let them do that for 10 years or whatever length of time you think's enough. And you look at the percentage who caught lung cancer. Now, since both groups were full of, oh, by the way, you tell them to do exactly what they did apart from that, right? So if you were a couch potato, you stay that way, right? If you ran the marathon every 2 weeks, you did that every 2 weeks. So the only difference between those two groups was smoking. And if one group gets cancer more than the other, you've got pretty good evidence now that that's the cause. So observational studies are sometimes the only way you can get information, but it's sometimes very difficult to get cause and effect out of it because of that. Now, the kind of gold standard amongst collecting data is randomized experiments. I'll give an example of a randomized experiment. You take 200 people again. I'm going to split them into two groups of 100. And this group, you do tutoring to. And this group, you do nothing. And then you collect data on how well they did in the exams. Now, the 200 students, right, that let's say it's a big university where they've got 200 students in their stats department, right, their stats classes, right? Within that 200, right, they're going to be young and old, males and females, good students, not so good students. But because you randomly assign them, right, so anybody, both groups are probably going to be pretty much the same. If the only thing you did that was different was tutoring, and you found out that the people who did tutoring got on average a little bit better than the ones that did nothing, don't you now have evidence that tutoring improves exam results? And you might even be able to put a number on it, like it tends to improve their grade by a couple of percent. Do you see that's a much better organized way of not only collecting data, but being able to make a decision about is there evidence to prove anything, right? Because these two groups are full of the same kind of students who got the same kind of lectures, right? And did the same kind of things, and some are good and some are bad, but it's equally good students and equally bad students in both groups. So if you make the two groups random, you tend to get that. And then you only do one thing to them, and the difference you can figure out must be caused, or hopefully you've managed to do it by that. That makes sense. This is a good way of getting data. Now, governments do all sorts of programs, but they will never do that. Okay, imagine you were doing a program on trying to get people to stop being alcoholics, right? So you do a intervention type of program. Can you imagine the government's finding 200 alcoholics and picking 100 of them at random and putting them through, you know, the Alcoholic Anonymous version course, and then at the end finding out how many of them right, are recovering alcoholics, and then the other 100 they just did nothing to them. Can you imagine what the newspaper article would look like? They let 100 people, you know, just continue. You didn't even help them, right? They just used them as guinea pigs so that they could see if the other lot worked. Kind of hard. You have to be quite cruel to get data. So let me finish by another one example of an experiment. Medical experiments are done a lot, testing new drugs, for instance. And what they typically do is, maybe it's 200 people, and the storyline will just change a little bit. "100 of them get the new drug, and the other 100 get the old drug. And then at the end, they find out, you know, a success rate." So let's suppose they get a new treatment for breast cancer, right? They've already got a treatment. They get 200 volunteers or 200 people who have got breast cancer, and they randomly split them into two groups. So some of that 200 people are going to be really, really sick, right? And some of them have, you know, they caught it very early and they're at very early stages. But both groups, because it's random, pretty similar. New treatment, old treatment, compare the results. Let's suppose in the new treatment, 50% of them are in remission. And the old treatment, 75% are in remission. Won't that drug never make the market? Won't the FDA say, why are we going to use a drug that isn't as good as the ones we're using right now? Okay, let's suppose the new drug got an 80% success rate. Can you see that the new drug could, if you do all the other checks about how dangerous and side effects, couldn't the new drug actually be introduced? In fact, might replace that one, except for cost. Don't brand new drugs cost a ridiculous amount of money? And generic drugs. So I'm making an assumption that the breast cancer drug has been out there so long, it's now a generic drug, right? It's very, relatively speaking, it's very cheap. Now, if you've got good insurance, you might be able to get the new drug. If your insurance ain't that good, won't you probably get treated with the old drug unless you want to fork out your own money? And the reason why these new drugs are so expensive is that for every successful drug that a pharmaceutical company comes up with, you know, there's at least 4 or 5 failures. And that costs a lot of money and time and expense. So they have to get their money back on the ones that work. And so what is it anyway? Do you get 5 years before you go generic, or is it longer? We'll say it's 5 years. And so that's where they get it. And it's very good. True story. When I was at Glasgow University, I was doing statistics there as well. And we heard in our class about a new treatment that was being tested in Denmark, and it was for prostate cancer. So we're talking, this is probably 40 years ago now. And typically what you do when you introduce a new drug comparing to the old treatment is, what you do is that you kind of watch the results. You don't wait to the end of 6 months and then just collect your results. What you kind of do is you just keep an eye on the patients all the way through. And the people that were on the new prostate cancer drug, were essentially dropping like flies. They were dying rapidly. And the company that was doing it didn't stop the trial. They should have said, the new drug is crap, it's killing people. In fact, what the drug was doing, instead of reducing the cancer, right, trying to inhibit the cancer, it had the exact opposite effect. It was stimulating the cancer. It was making it grow faster. And that's why it was causing the death rate to be even faster than it would have been. You know, the thing was growing, masticating and going everywhere. And they didn't stop the trial. They went to the end of the trial. And that meant there was a lot of people in that new group that probably died for the sake of keeping that company convinced. They were hoping upon hope. Okay, at the beginning it's bad, but if you can go over the hump, then it'll do its job and it'll be successful. You know, because some drugs are really dangerous, aren't they? And you could die of the treatment. But if you can survive the initial treatment, they may be successful in killing the cancer, right? So we're hoping that. Totally immoral, but technically legal. You signed up as a volunteer for that treatment. That's your thing. So let's talk a little bit more. Told you today was listening to me. Can I promise you that the next day it'll be full of math and doing stuff? There's a thing called placebo effect, and then there's these things called single and double blind. Let's talk about the placebo effect. Again, this is probably a term that the nursing program people or people who are into medical might have heard of, although you may have heard of it yourself. Does anybody know what it is?
Like,
Want to share?
someone's like taking, like, in studies, sometimes they give someone a sugar pill or a placebo pill to pretend like they're taking a pill, and someone actually gets a pill, and the people taking the sugar pill actually think they're getting better and tricks their mind, even though they might not be getting the actual medication.
Yes. It's a strange phenomena that when it first came about, there was a bit of skepticism that it actually existed. And what happens is, and they've done it and they've found out that it works, is that if you take a pill and you believe that that pill is going to do something, like it's going to make you feel better, or it's going to reduce your pain, for instance, because it affects you psychologically and you believe it, and your brain is a big influence on your health. Do you know your brain can make you sick? You can physically get sick because your brain can, affect your immune system, right? For example, people who are under a lot of stress, isn't their immune system very often weaker than if they're not under stress? And stress is essentially your brain being put into pressure mode, right? And they found out that it worked. And it's quite clever. It's amazing what happens. It works better in some situations than it does in others. If you've got a broken arm and its bone is sticking out, and I give you a sugar pill and tell you it's a pain pill, do you know it's probably not going to do any good at all? You are going to be in agony. Trust me, right? So the placebo effect isn't like huge in those situations, but it does work really well for subjective things. Suppose you have got a headache, right? And it's got a scale of 1 to 5 kind of headache, right? 1, it's just starting, 5, it's really bad. And I give you a pill and you believe that pill's like an aspirin or whatever. You will very often feel after you've taken that your headache isn't quite as bad as it was. It's not gone away, but instead of a 4, you'd probably grade it as a 3 now. And because isn't pain really your brain telling you it hurts? Your brain is actually, when you feel pain, it's your brain sending you a signal saying, this hurts, stop doing what you're doing that's making me hurt, right? It's a kind of brain mechanism. So placebo effect works really well there. So they had to figure a way of avoiding it so that it wouldn't interfere with the data, especially when you're taking medication for pain or anything. You don't want the placebo effect to kick in. And so we have these two guys. I'll talk about the double blind first. In a double blind experiment, the patient doesn't know if he's getting the real pill or the sugar pill, right? Just doesn't know. And the doctor, who very often when you do these, your own doctor gets used as part of it, right? You sign up for a new, clinical trial, they'll pay for the doctor's bills and the pills and, traveling to your doctor, right? That's their side. Or you may go into a clinic and the doctor there will test you, right? But the doctor who's looking at you, he doesn't know either. So what happens is that the doctor will get a list of, this doctor gets a list of patients who are getting the new pain medication. There's 5 of them. He doesn't know if all 5 are getting the pain pill or only 2 of them. He doesn't know which 2 it is. But what he's going to do is he's going to record how that patient is and what their blood pressure is and anything else that is interesting for that thing. So if you don't know what you're getting and the doctor who's collecting the information doesn't know what you're getting, that's called a double-blind experiment. And you might think, well, I understand why you don't want to tell the patient because of the placebo effect, but you might wonder why they don't let the doctor know. Any ideas?
They could have a bias in reporting or favoritism or something like that.
Yeah. Let's say that your doctor, right, is your own doctor. So very often you have a personal relationship with that person. So they're concerned about your health, right? And your doctor knows that you're getting the sugar pill. And this is, maybe it's a pill that's meant to reduce anxiety, right? Let's say it's that kind of pill. And so you come in and the doctor says, how are you feeling? Are you really okay? You see, the way he knows what's going on and you're getting a sugar pill. So he's not deliberately even, it's just subconsciously. Can't he project that fact to you and influence, how you are feeling? Yeah. So yeah, it causes bias. And that's what a double blind looks like. What's a single blind?
I'm assuming when it's just the patient that is not knowing if it's placebo or...
Right. Essentially, that's it. There's no good reason. If you can do a single blind, can you do a double blind? It wouldn't be that hard to administer. But, for whatever reason, single blinds sometimes get used. Now, you cannot do a double blind experiment in every single situation. Suppose you were looking at 2 different techniques for hip replacement. It would be pretty obvious, wouldn't it, that you were getting one version of the hip replacement rather than the other? At least to the doctor who was performing the operation, right? You see, you wouldn't really be able to hide that from both groups. And if that's the way it is, then that is the way it is. You just have to live with the fact that you can't. But if you can do a double blind, it's really good because it tends to mean that the data you're getting is unaffected by the placebo effect and is the pure results. Are we good? Now, the next thing I'm going to show you is something that well, let me do my version and I'll show you what the book's version is. There are 2 guys in town. that cause problems when we try and find cause and effect. Lurking variables and the new guy that you might not have heard of yet. Confounding variables. So what we have here is that we found a good relationship. We think A is causing B, right? We think the number of cigarettes you smoke is making your chance of getting cancer going up, right? Whatever it might be. And there are two situations that can screw up our interpretation of what we're saying. And one is called a lurking variable. And just to remind you again, can you remember the number of TVs, average televisions that a country might have, and the life expectancy? And it was a pretty good fit, right? But it wasn't how many TVs a country owned that was really affecting directly how long people lived. Wasn't this just measuring the wealth of a country? Right? So that would be a lurking variable would be, if you like, the real reason for the connection. And the reason it works is that isn't wealth very closely connected to how many TVs a country probably has, right? Very rich countries would probably have a lot of TVs in your house, and very poor countries won't, and so on. So what's a confounding variable? Well, it's a little bit subtler. So here is an example of a situation where there's confounding variable. There's a summer and there's winter. And a professor decides he wants to try out two teaching styles to see whether or not these teaching styles are better. And so one teaching style is formal and the other is informal. So in the formal teaching style, he doesn't tell jokes, he wears a suit, he's very professional, he calls everybody by their first name, and he prefers to be called Professor Robertson or whatever, right? Very formal guy. And he teaches his lessons in a very formal kind of way. And then he does that for 3 classes during the summer. And he gets an 8% success rate. And then on the winter, he goes informal. So he tells jokes and he wears t-shirts and calls people Jack when their real name is Jacqueline or whatever, right? Very informal kind of guy. And he teaches 3 classes. And he gets 75% success rate. And he analyzes this and he says, well, from what I can see here, formal is more successful teaching style than informal. But there's a confounding variable. He only taught in the summer the formal way, and he only taught in the winter in the informal way. Couldn't these be caused by when in the year you teach people? Because maybe in the winter, people are just a little bit more, you know, I can't say lazy because that's not the word I'm looking for, but you know, with the lack of sun, you just don't have the same energy anymore, right? Maybe it's harder to concentrate. Couldn't the season be the cause of this difference and not the teaching style? But because
Seasonal
you all,
depression?
say again?
Seasonal depression.
Yeah, seasonal depression could be kicking in here and causing your, you know, not to do as well, right? But can you see, because it only done formal in the summer and informal in the winter, you can't separate out that information anymore. Couldn't it be one or the other? How, you can't tell. Now, if during the summer he did, like, you know, 1 class formal and 1 informal, and then during the winter he did 1 formal and 1 informal, couldn't you then separate out those 2 variables to see which one was actually, you know, the main ingredient, right? So confounding variables are variables. I like the word confounding because the word confounding means I don't know. I'm confounded by that, right? I don't know. Can you see? You don't know. You know it's one of these two things probably, but you don't know which one it is. How about that? Now I'm going to zoom over and show you what I got from the textbook. Okay, lurking variables are common problems in observational studies when an apparent association between two variables is really just common responses to a third unseen variable. Commonly cited examples involve a positive association, for instance, between ice cream and drowning. The more ice cream that is being consumed in a month, the more people are drowning that month. It's a positive association. Right? And then you look at, should you conclude from that, that when people are saddened to hear of someone drowning, then they attempt to cheer themselves up by eating ice cream? Or if you are eating a lot of ice cream, then you go swimming, you drown. Right? In fact, the explanatory variable is probably heat. During the summer, you eat a lot of ice cream. During the summer, you probably swim more. The more times you swim, the more opportunities to drown. In the winter, you don't eat as much ice cream, and you probably don't swim at all, at least in lots of places. Can you imagine then that the number of people who drown goes down? Confounding is a different issue. I agree with that. Confounding arises when the response we see in an experiment is at least partially attributed to an uncontrolled variable. So a store's special promotion may increase video rentals, but the marketing folk can't be sure what did it. Was it because the weather that they did the promotion was bad, so people came and bought videos and stayed at home, right? So it was just a coincidence that the promotion happened during bad weather, and that's the real reason people bought videos when you used to buy videos, right? Or whether it was the promotion itself which increased the sales. Can you see it's sometimes hard to, you've got two reasons, but you can't separate them. Does that help or hinder the idea of what a lurking is compared to what a confounding? Because it's very easy to kind of overlap a little bit. In fact, I bet you in some situations there may well be an overlap where is it really a lurking or is it more a confounding? We're ready, almost finished. Two guys to finish with, but they're going to be nice and short. Explanatory and response variable. You're going to be given a story occasionally in the homework, and one of them's explanatory and one of them's the response. And explanatory is kind of the X, right? And response is kind of the Y. So you might have a story where you look at the number of hours that a student studies and you compare it against their grade. The number of hours that they study is the explanatory variable, and the grade they got is the response variable, right? That kind of situation. So in many cases, one thing is being used to compare against what the response is. So you give somebody a drug and then you figure out if it benefits them, right? The explanatory variable might be the strength of the drug. You know, you give them a 5 milligram, a 10 or a 15 or a 20. And the response variable was what happened to their headache? You know, what kind of scale did they give from a 1 to 5? I think that's probably all I need to say about them. You're comfortable, explanatory, response. You do the something and something happens. You do the something is the explanatory. What happened is the response. Are we good? Everybody happy? You'll probably be glad to know that tomorrow I will not be talking all the time. At least I'll try not to. In fact, if I do, David, you're going to take over and tell some jokes if I try, right? Say hi.